Welcome back to The Natural Doctors. I'm Dr. Katie Dinello.
And I'm Dr. Jennifer Stagg. This is the second episode in our series on weight management. And so in this episode, we're going to really focus on what we do to assess patients that are coming in with weight loss resistance is kind of how we like to categorize it. But these patients are coming in and they've done everything right. So if you haven't seen our first episode in this series, go back and watch that one. But for a little recap, we talked a lot about detoxification, our environmental chemicals that we're so burdened with in our society. And then we talked about the processed food in our environment and how that contributes. And then, of course, our stress in modern culture and disconnection from nature. So please go back and take a look at that episode. After you see this one, I guess, go get that background information. Yeah. But so then when patients are coming in, they're coming in and so some of those patients might need some help with some of these things we talked about in that first episode. But a lot of these patients come in and they're saying like, okay, I'm eating organic. I started meditating. I'm exercising, everything, I've cleaned up everything in my home and I'm still not losing weight. And maybe they've been, like, I think about, we can use some case examples here. So I think about some, like a lot of times a common sort of presentation is women who have maintained a pretty normal weight and then they get to perimenopause and they start gaining weight and then they are kind of stuck, right? They start employing these strategies, cutting calories, trying different diets, different macros and combinations. And maybe they lose like a little bit of weight, but then they're just like stuck. And so this is when we start to work with all of our naturopathic assessments and tools to try to figure out, well, what actually is going on for that patient, right? Yeah. And so probably one of the first things we start to look at is inflammation. And a lot of patients do come in and they say, I'm inflamed, which a lot of times people feel that,
feel it,
right? Yeah. So do you want to give us a little kind of background on how you would work with a patient to assess them for inflammation?
Yeah, absolutely. So I like this example because it really often is women who are kind of in their late 30s, 40s, 50s, right? Who are starting to go through perimenopause and then menopause. So, these women are like, I've never had a hard time maintaining my weight, right? It's always been pretty easy for me. And then it feels like overnight they're gaining weight and they swear that nothing changes, right? And I feel for them. I totally do. So if you are one of my patients who has said that, no, I truly believe you. You know that I do. So, right. So then, yes, they start looking things up and they're like, okay, let me clean up my environment, my kitchen, right? Let me work on my sleeping habits, things like that. And it will make them feel a little bit better, right? Because all of those things do, my goodness, they're foundations of health. They matter. But then when it comes to the weight loss resistance piece, oftentimes there are these underlying factors. Inflammation is one of those things. And so, yes, women will come to us and they'll say, gosh, I just feel so inflamed, right? And so that will cue off a lot of different things in my mind of, okay, we got to work on some things and we need to run some labs too. So something that we can do first is to run some very, very basic, simple labs. Something called our HSCRP or our C-reactive protein. This is a protein that your liver makes in response to inflammation, and it's a really good gauge as to how much inflammation is going on in the body. And so often that number comes back elevated, and most times women are like, oh, thank gosh, right. I knew I felt inflamed, and it's really justifying for them. So that's one spot that we'll start at, right? Yeah. But what we'll often do as well is look at a lot of different lifestyle factors. So everything we talked about in episode 1, we'll make sure that that's well covered because, again, foundations of health, we can't get around that. But then inflammation becomes a little bit trickier because we really have to kind of be detectives and try to understand where is this inflammation coming from. Yeah. Because a basic lab like CRP, it's general. It doesn't tell us where it's coming from. And so that's where we start to use our naturopathic and functional medicine approaches. And so we'll look at things like gut health, cortisol, circadian rhythm, even things like motivation and what you're doing during the day, right? Your relationships, how you're interacting with people. All of these things can affect your inflammation. And so it really matters.
Yeah, I'm so glad you brought that up, because the sort of conventional approach to inflammation would be like, well, let's start you on an anti-inflammatory. And sometimes that might be part of the plan, but it is really all about, well, why is that inflammation happening?
Yep.
And, you know, if you do your detective work and everything checks out fine, then a lot of times for these women, it's a product of aging, right? So as we get older, we have inflammaging. And so it's just our body doesn't do as good a job of this like stage 2 of where we turn off inflammation. And there are nice interventions there that we can use. We use these specialized pro-resolving mediators, like very specialized fish oil. So this is an instance where we might be using a supplement because there's not like, you know, it's not another option there. Right. So that's actually a really targeted solution. Another thing that's happening to these women, not only are we aging, we're also having these changes in hormones, especially estrogen. And so as estrogen levels decline, inflammation actually rises, right? So hormone replacement can be helpful for some women, but it might be phytoestrogen as well. So our natural plants that bind our estrogen receptors that are anti-inflammatory estrogen receptors, there are different types of estrogen receptors, and the plant types really bind those anti-inflammatory receptors. And so sometimes that's enough to do the trick. And women might not be having hot flashes or anything. It might just purely be this weight issue, right?
Exactly. I love all of those things. Those things really matter, especially if we are in that perimenopause, menopause age where we are seeing those declining levels of estrogens. Supplements, as Jen mentioned, can be very helpful when it comes to inflammation, right? They're not a permanent fix, but they can be a really nice adjunct to all the lifestyle things. And in this perimenopause timeframe, you know, supplements are a perfect addition, right? They're supplemental to all of the foundations we're using. Jen talked about SPMs, those specialized pro-resolving mediators. Those are great. Fish oil is another great one. Curcumin or turmeric, right? We have a lot of great herbs that can help us with inflammation.
So many good tools there.
That's great. I was going to say, let's move on to insulin resistance if you're okay with that.
Yeah.
So another thing that we'll often test these patients for is insulin resistance. Now, this is something your conventional doctor is likely not going to test, which is frustrating, but that's okay. Something, a test that a lot of people know about is like your hemoglobin A1C or your fasting blood sugar. Those can be normal and you can still have insulin resistance. So you really want to get at least a fasting insulin level checked. If you have the ability, something a little bit fancier would be an insulin resistance score, where we also check something called C-peptide or a HOMA-IR score as well. That's great too. So we have a couple of options here. But like I said, you could have a great fasting sugar level, but still be insulin resistant. So we want to look at that full picture. And that insulin resistance is a stubborn reason why weight does not come off, right?
And it's so common. And another thing to consider is if you are asking your doctor for an insulin test, that the reference range that you're going to get from your conventional lab, it might look like it's normal. So the conventional lab, like Quest, is 17, I believe, still. And so if you get your insulin test back and it's 15 and it looks normal and your doctor is like, nope, your insulin's fine, it's not fine. Let me tell you, it needs to be under 5 for just a straight up fasting insulin. Now, sometimes, as you said, this insulin resistance score, which is done through Cardio IQ, can give us a little bit more information about the severity of it. So it might not even look that bad. Like your insulin might come back and it's mildly elevated. It might be 9 or 10, but when you combine it with the C-peptide, you could end up with a really high insulin resistance score that then helps us really understand, well, why is that patient so metabolically blocked?
Exactly.
And, they're using all the lifestyle strategies. We might have to like really be careful about starches, even, if they're eating organic, limiting portion sizes, having them consume it with lean protein and fats and enough fiber. But this is another instance where we have really good supplement tools like plants, especially berberine, one of our favorites. I think we've talked about that probably most episodes.
Yep. I mean, we do because it works so well. It's such a versatile herb too.
Yeah.
And, with insulin resistance, this is also where I get very, very nuanced when it comes to nutrition. And oftentimes, patients will think they're doing a great job, and they are. You guys are trying so hard. But when you see what your insulin resistance score is, you realize, okay, maybe I'm actually not quite doing as much as I thought I was doing from the nutrition front. So I might add in things like we really want to start our meals specifically with protein and vegetables, and then we move on to our carbohydrates, right? So even that small distinction can make a big deal when it comes to weight loss resistance. I am also a stickler for making patients stop eating about 2 to 3 hours before bed, right? So that they really get about a 12-hour overnight intermittent fast. That doesn't push too much into the morning, right? Because we want to eat within about an hour of waking up. But that can also make a huge difference if you're struggling with a high insulin resistance.
Oh, I agree so much. This concept, intermittent fasting, we think about it in so much more detail that it really is metabolic rest and digestive rest, right? We know that we need both of those systems to be not constantly bombarded with food signals, right? We're not designed to be eating all day, like 20 hours a day,
exactly,
18 hours a day, right? So this is another way that we've just gotten so far away in our convenience food society and just like the structure of how we live that that's the reason why our bodies are sort of like reacting like it should, and it's an adaptive mechanism.
Yeah, exactly. That snacking piece, I just want to spend another minute there because I see this a lot in clinic where I'll ask a patient, tell me about what an average day of eating looks like for you. And they'll go through breakfast, lunch, and dinner. And then they won't say anything about snacks. And so then I'll follow up and say, tell me about snacks. When are you eating snacks after dinner and between meals? And then they realize, oh my gosh, I am. And so I have a lot of my patients track their nutrition, even if it's just for a week or two. And they really see when it's written down or it's in an app, like, oh my gosh, wow, I am snacking a lot more than I thought. And to your point, our bodies are not designed to be taking food in all day. We really want to strive for 3 to 5 hours, the minimum, between meals, and then that longer overnight fast if we can. So it's a big deal for sure.
That is important. So maybe we'll touch briefly on leptin resistance. We've got a lot to get through here.
I know we do.
There's so much that we look at for patients that are dealing with weight loss resistance, but leptin resistance is one of those. And what we've talked about so far, chronic inflammation and then high insulin or insulin resistance desensitizes those leptin receptors. And those leptin receptors are what allows, kind of like speaks to your brain and tells you, okay, I'm done. Like I've had enough food. I'm satisfied. It quiets the food noise basically, right? So we are hearing a lot about food noise in the GLP-1 era. And some of that is coming from leptin also, right?
Yeah, exactly. I will test leptin in a lot of my patients so we can see if they have this leptin resistance. So normally, if we gain a little bit of weight, which happens to almost all of us, a busy season of life or, whatever the case is, you gain a little bit of weight, leptin levels naturally increase. And they should signal to the brain like, hey, let's decrease appetite a little bit so we're taking in fewer calories so we can get back to our healthy maintenance weight. But because we eat such processed, hyperpalatable foods, leptin doesn't do that. It just keeps rising, and our brain doesn't recognize the signal, and we keep snacking, we keep eating, increasing our calories, and that's what leads to that leptin resistance. And then downstream, we get what's called metabolic inflexibility, right? Where we have a really hard time losing weight, as we've talked about, but it's because we're not in tune with those hunger signals, right? And so you might try to do a 12-hour overnight fast, but you wake up during the night really shaky because your insulin is out of whack, right?
Yeah.
That's that metabolic inflexibility that we see. So leptin resistance is a really big deal. And it's a huge underlying cause of that weight loss resistance.
Yeah. Yeah. So important. Next, let's maybe talk about GLP-1.
Yeah.
I know we're going to have a whole episode about GLP-1 and all of that, but basically this is a peptide that is released naturally in our guts, right? So this is part of our digestive system or the hormone system that is in the gut. And it does that in response to food, incoming food, right? And that peptide is going to promote satiety, just like leptin does, but it also sort of slows down the digestive tract.
Yeah.
And what we're eating really influences that, and also because it influences our microbiome, and that's going to lead us into a microbiome a little bit discussion too here, which is good. But if you have a dysfunctional microbiome, a lot of times then you'll have dysfunctional GLP-1 function, and then you're going to be craving food, having disrupted metabolism. And what are the ways that we could sort of like assess that in a roundabout way for patients?
Exactly. There's a couple of different ways here. But testing our microbiome is one great way where we can do that, right? We can actually measure things like Akkermansia, right? Which is a big important player in our gut microbiome when it comes to natural production of GLP-1. Another way is simply by doing a fast, right? So even if you just start with 12 hours, can you make it through that fast feeling satiated, right? If you can't, that's an indication that you have low levels of GLP-1, right?
Yeah. That like what we call like, are you fasting adapted? Like how well can you go without food? And so you'll see a lot of that with blood sugar instability, of course, but also with this GLP-1 impaired gut signaling.
Yeah. And we know with GLP-1, right? Again, we'll talk about this more in our next episode. But when we have insulin resistance, when we have inflammation, leptin resistance, we make less GLP-1, like we have less of it in our body. And so it's this cycle that just kind of repeats itself, and we have to put a pin in that cycle to really stop it.
Yeah. So it's no surprise that we've gotten to this point where people are really turning to GLP-1s because of all the like metabolic meltdown essentially that society has created, right? For us. And it's really unfortunate because you really can turn this around by living a more natural lifestyle and employing a lot of these strategies that we're talking about.
Exactly. I want to just touch briefly on a root cause of weight loss resistance that, in my opinion, doesn't get enough attention, and that's mitochondrial dysfunction. So I see this a lot in my clinic, where the reason why this connects with weight loss resistance is because it's that fatigue and that low motivation aspect. And so if you all remember to high school biology, mitochondria are the powerhouse of the cell. And so they literally make our ATP or our energy. And for so many different reasons, including nutrient deficiencies, environmental toxins, inflammation, oxidative stress is a big one, our mitochondria just don't function very well. They're not effective at making energy. And so this is something that we really start to uncover with our patients, especially those who just don't have the motivation to do what they need to do in order to lose weight, or they're just really, really exhausted. Do you see that a lot? Are you doing stuff with
absolutely.
mitochondria?
Right. So, I mean, with the mitochondria, it again is another sort of byproduct of like the toxins that we're exposed to and that like stewing in chronic inflammation, right? So then it impairs the mitochondria, and people will commonly say they're fatigued. And a lot of times this comes up for patients who we can't find any other cause for their fatigue, right? So we've done thyroid testing, which is another thing you want to make sure you get assessed. We might not have a lot of time to talk about that one, but that's something that's important. We're testing for anemia and various nutrient levels, and everything's coming up looking great. A lot of times those cases are mitochondria, right? That where you have mitochondrial dysfunction. Some of course, lifestyle changes are going to help with that in the long run, but there are some really nice supplements that we could actually use here to help like really give specific fuel to the mitochondria. So what do you like to use there?
Yeah, I know. This is actually one area of medicine where supplements make a huge difference. And so really specific B vitamins are great. CoQ10, alpha lipoic acid, L-carnitine. These are just a couple. And sometimes I use them individually, really depending on what I'm working with. Sometimes I'll give a supplement that has a couple of those in there so we can really overwhelm the mitochondria, but it makes a big difference. So if you are that person who is just chronically exhausted and you just don't have the motivation to eat healthy, make healthy decisions, or you try and you're just not getting anywhere, definitely check out those mitochondria for sure.
Yeah. So we don't have a ton of time left. So maybe we should sort of just run through some of the functional testing, maybe might be the best way to cover the most important topics left. So we did talk about insulin, glucose, hemoglobin A1C, testing for CRP. Let's touch a little bit on the thyroid tests that you would recommend and thyroid ranges as well. So a lot of times people will come in with their thyroid test and they're like, oh, this is normal, but we take a look at it and not so normal, right? Yeah, so talk about that.
Yeah, we have different ranges for sure than what you'll see on the conventional lab results. So first thing I look at is TSH. So TSH is a hormone from the brain and it talks to the thyroid. So your thyroid is a little butterfly gland that sits at the base of your neck. And so TSH is kind of that main regulator where it's telling the thyroid what to do. Now, the conventional range for TSH is huge. It's way too large. We really like to see TSH 2.5 or less, right? The lower, honestly, the better, right? Yeah. Because when it's lower, it means your brain is not working as hard to control your thyroid. And that's great. That means everything's working really well. So that's the first one we're looking at. And you like less than 2.5 as well.
Yeah, absolutely. Right. And now sometimes you can see patients also that are in range, right? And they're maybe running like 1.7. And so we're well under 2.5, but they have all the signs and symptoms of hypothyroid, right? So this is a clinical hypothyroid potentially case. And in those circumstances, like sometimes we actually would use a little bit of thyroid hormone support, like a glandular that's nice and gentle, or we might use a thyroid formula that has botanical plants and certain like ingredients that are going to improve that thyroid hormone function.
Exactly. Yep. Because we'll also look at free T3 and free T4, which these are active thyroid hormones, and especially free T3. That's what's doing all the fun metabolic things that we think about when it comes to thyroid hormone. And so another area where we can see some downfall is if we're not converting T4 into T3, right? And a lot of times that has to do with stress and nutrient depletions. And so I'll put people on some really specific nutrients, iodine, selenium, even ashwagandha as an herb is great for this, to really optimize that conversion of T4 into that active T3 metabolite.
Yeah. That's really fantastic. So that leads us to maybe cortisol and looking at stress. We definitely want to do a cortisol test, get a morning cortisol. You can do more extensive cortisol testing where you're doing a 4-point salivary cortisol to really understand like the circadian rhythm of cortisol production. And then that, you know, treating cortisol sometimes for patients that actually are testing out in hypothyroid range, that we as naturopathic doctors a lot of times will do adrenal support before we address the thyroid, because that might be the true cause of the conversion issue in the beginning.
Absolutely.
Other tests. Vitamins. What
nutrients.
Vitamins do you like to test?
Yes, at the minimum, vitamin D, B12, folate, B6. Those are my go-to. Typically magnesium, right? But a lot of times, especially if I think that there's mitochondrial dysfunction, I'm ordering a much more extensive nutrient panel where I'll have lots of nutrients. I'll also have some organic acids on there as well. That gives me a much clearer picture of what's happening with the mitochondria.
Yeah, which is great. So basically, you know, when you're seeing a naturopathic physician, you're dealing with weight loss resistance. We're going to obviously look at your whole history and look at what you're doing in terms of foundational lifestyle approaches. And then we're going to get wild with labs,
Exactly.
which most patients really appreciate, honestly.
Yeah, they do.
But we start out with a lot like conventional labs, like all of this tends to be covered by insurance. I would add like omega-3s, I think we check as well. So that's another one when we're looking at inflammation. And then there are those functional tests, like you mentioned, like where we, you know, might be doing organic acids, we're doing microbiome testing, we're looking at things like mitochondrial dysfunction. Looking at toxins, environmental, like heavy metals and those things too. So a lot to consider, a lot to unpack.
Yes.
I think we did a good job getting through all this information.
Yeah, this was a jam-packed episode, everybody. But we could talk, I mean, I could talk about weight loss forever. So, but thank you so much for joining us on The Natural Doctors. Make sure you tune in for our next episode of this weight loss series where we're going to talk all about GLP-1s. That's going to be a really fun one. So thanks for joining us, and make sure you like and subscribe on YouTube as well.
Sometimes life just happens. Don't worry. Farmington Motorsports will get you back on the road and at a fair price. From towing to tires, emissions to transmissions.
Our ASC certified techs do it all.
Farmington Motorsports is a family-run business. We're a Napa Auto Center and AAA approved. We work on all makes and models from preventative maintenance to major repairs.
And every repair is backed by our 2-year, 24,000-mile nationwide warranty.
When life happens to you, don't worry. Farmington Motorsports.